If your doctor told you high blood pressure is about too much salt and too much fluid, they weren't lying to you, but they weren't telling you the whole truth either. And that gap between what you've been told and what's actually happening inside your body is why millions of people wake up every single morning, take their blood pressure pill faithfully, get perfectly controlled numbers on their monitor at their next checkup, and still end up in the emergency room with a stroke. Think about that for a moment. The number looked fine. The doctor said, "Keep it up." The prescription was filled every month without fail, and the stroke happened anyway. How does that happen? It happens because the medication was controlling a reading, not repairing the damage. Here's the analogy I want you to hold in your mind for this entire video, and I promise it'll make everything click. Imagine your check engine light comes on in your car. Instead of taking it to a mechanic, you reach under the dashboard and cut the wire to the light. Light goes off. No more warning. You pull out of the driveway thinking, problem solved. But the engine is still broken. It's getting worse by the day. You just can't see it anymore. That is what most blood pressure treatment is doing right now for tens of millions of people. And I don't say that to frighten you. I don't say that to make you distrust your doctor. I say it because you are sitting here watching this video, which tells me you're someone who actually wants to understand what's going on inside your own body, and you deserve a real answer. I'm Dr. Franklin. I've spent years in preventive cardiology, watching patients do everything right on paper, the medications, the low-sodium diet, the follow-up appointments, and still slowly decline. And the question that drove me was always the same: why? The answer I found after digging into the research that never makes it into a standard 15-minute office visit comes down to three specific mechanisms. Three things happening at the cellular level inside your arteries that standard blood pressure care doesn't touch. Three silent forces that keep the damage progressing even when your numbers look perfectly controlled. Today I'm going to walk you through all three, and then I'm going to give you a concrete step-by-step protocol. Things you can genuinely begin this week that actually target those root causes, not manage them, address them. The most important thing I'm going to share with you comes about halfway through. So stay with me, because by the time we're done, you're going to understand your own cardiovascular system better than most people ever do. Before we continue, tell me your name and where you're watching from. I read every comment, and I'd love to know who I'm helping today. Let's open the hood. The problem with how we think about blood pressure. Here's the thing. High blood pressure or hypertension affects roughly 1 in 2 American adults over the age of 55. That's an extraordinary number when you think about it. We're not talking about a rare condition. We're talking about something that has quietly become the default health state for most aging Americans. Now, here's what most people believe high blood pressure is. Too much pressure, too much fluid, too much sodium, simple fix. Take a pill, cut the salt, lose a little weight. And look, that framework isn't entirely wrong, but it is dangerously incomplete. Here's the analogy I want you to hold on to for this entire video. Think about an old garden hose, the kind that's been sitting outside for 15-20 years, cracked, stiff, dried out, sun-bleached, and brittle. Now you turn on the water. Even at normal water pressure, the same pressure that would be totally fine flowing through a brand new flexible hose, that old stiff hose starts to strain. The joints crack, the connections leak, the pressure at the nozzle is inconsistent. Now the question is the problem with the water pressure, or is the problem with the hose itself? That distinction is everything when it comes to hypertension. Most blood pressure treatment targets the water pressure, your fluid volume, and heart rate. But the real story is about what's happening to the hose, your arterial walls, their flexibility, their structural integrity, their ability to handle blood flow the way they were designed to. And three very specific mechanisms are silently destroying that flexibility in most people over 55. I'm going to walk you through each one. Before we get into the three mechanisms, let me ask you something. Where are you watching from today? And more importantly, have you been struggling with high blood pressure even though you're taking your medication and doing everything right? Tell me in the comments. I read every one of them, and it helps me understand exactly what you're dealing with. Mechanism 1, the invisible lining no one talks about. Let's start with something your doctor has almost certainly never mentioned to you by name. Inside every single blood vessel in your body, your aorta, your coronary arteries, the vessels in your brain, your kidneys, your legs, there is an extraordinary structure called the vascular endothelium. Now, think of the endothelium like the inner wall of a river. And just like a healthy riverbank is protected by roots, soil, and vegetation, the endothelium has its own protective coating. Scientists call it the endothelial surface layer, or ESL. This surface layer does something remarkable. It acts like a biological sensor and communicator. When blood flows across it, it detects that flow and sends a signal deep into the vessel wall, instructing the surrounding muscle cells to relax and expand. The messenger it uses to send that signal, a tiny gas molecule called nitric oxide. You need to remember that name, nitric oxide. It will come up again. When this surface layer is healthy and intact, your blood vessels are flexible. They expand when pressure rises. They cushion the impact of each heartbeat. They protect downstream organs like your brain and kidneys from shock waves. But here's where things go wrong for most people as they age. 3 things tear apart that protective surface layer. Number 1, chronically elevated blood sugar, not diabetic level blood sugar necessarily. Even repeatedly spiking above 140 meters per hour mLDL after meals, which millions of older adults do without realizing it, triggers a chemical process called glycation. Think of glycation like rusting. Sugar literally sticks to and degrades the proteins that make up this protective lining. Number 2, chronic low-grade inflammation, not the kind you feel after a sprained ankle. Silent inflammation driven by processed food, poor sleep, metabolic imbalance circulates through your bloodstream like sandpaper, continuously scraping away at the inner surface of your vessels. Number 3, oxidative stress. Free radicals. Unstable molecules generated by stress, pollution, poor diet, and even normal aging attack the cells of the endothelium the way oxygen attacks exposed metal. Over years and decades, these 3 forces gradually strip away the endothelial surface layer. And when that happens, 2 catastrophic things occur simultaneously. 1, your vessels lose the ability to produce adequate nitric oxide. They can no longer relax properly. They become chronically tense and constricted. 2, the unprotected vessel wall becomes vulnerable to invasion. Inflammatory particles, cholesterol, calcium, they now have direct access to the vessel wall tissue and they take it. This is where plaque forms. This is where calcification begins. This is where arteries go from flexible and adaptive to stiff and fragile. And I want to be direct with you. No blood pressure medication repairs the endothelial surface layer. Not Linapril, not amlopine, not metoprolol. These medications are doing important work managing your pressure, while the underlying damage continues silently. Mechanism 2, magnesium depletion, the missing mineral epidemic. A few years back, I had a patient, I'll call him Robert, 68 years old, retired engineer, meticulous man. He came in with a blood pressure of 158/96. He'd been on medication for 6 years. He handed me a food diary. His diet was actually remarkably clean, low sodium, lots of vegetables, minimal alcohol. He exercised 3 days a week. I ran a panel on him, including something most routine checkups don't measure, a red blood cell magnesium level. It came back significantly low. Now, Robert thought magnesium was just a supplement people took to sleep better. He had no idea that magnesium is one of the most critical minerals in the entire cardiovascular system. Here's why. Your arterial walls are lined with smooth muscle cells. These cells need to rhythmically relax and contract to regulate blood flow. And magnesium at the cellular level is the key that unlocks those muscle cells and allows them to relax. Think of magnesium like a natural biological brake on vasoconstriction. When magnesium levels are optimal, your arterial smooth muscle stays supple, responsive, and balanced. When magnesium is low, which studies suggest affects upwards of 45% of Americans, and that number climbs sharply as we age, those muscle cells lose their ability to fully relax. Your vessels stay in a state of chronic tightness. Blood pressure rises. But here's what makes magnesium depletion particularly insidious. In older adults, 3 of the most commonly prescribed drug classes for seniors actively deplete magnesium from the body. Diuretics commonly prescribed for high blood pressure flush magnesium out through the kidneys along with the sodium. So the very medication treating your hypertension may be worsening one of its root causes. Proton pump inhibitors for acid reflux, among the most widely used medications in people over 60, are well documented to reduce magnesium absorption over time. And here's one that surprises people. Even excessive stress and poor sleep deplete magnesium rapidly because cortisol, the stress hormone, promotes magnesium excretion. The result, a quiet, invisible deficiency in a mineral your arteries desperately need, running in the background for years, never tested, never treated. Robert started on magnesium glycinate, one of the most bioavailable forms, gentle on the stomach. Within 10 weeks, his blood pressure had dropped to 138/84. Not dramatic yet, but real measurable movement without changing anything else. We'll talk about doses and forms in the protocol section, but I want you to understand the mechanism first. The mineral is the mechanism. The depletion is the disease. If you're still here with me and finding this helpful, take a moment to type 2 in the comments. It lets me know you're watching and getting value from this mechanism. 3. The stress vessel connection your doctor skips. I want to talk about something that gets dismissed far too quickly in modern medicine. When older patients mention stress, the death of a spouse, financial pressure, the anxiety of aging, the isolation that comes with retirement, doctors nod sympathetically and say, try to relax, and then they move on to the prescription pad. But the physiological relationship between chronic psychological stress and hypertension is not soft. It is not secondary. It is not a lifestyle footnote. It is a hard documented cellular mechanism. Here's how it works. When your brain perceives a threat, real or imagined, physical or emotional, it activates the hypothalamic pituitary adrenal axis. Your adrenal glands release cortisol and adrenaline. Your heart rate increases. Your vessels constrict. In the short term, this is a beautifully designed survival system. Blood pressure rises, muscles get fuel, you're ready to respond. But in chronic stress, the kind that doesn't turn off, this response becomes a permanent background state. Cortisol, released in excess over months and years, does 3 specific things to your cardiovascular system that directly drive hypertension. First, it suppresses nitric oxide production. Remember nitric oxide from mechanism 1? Cortisol disrupts the enzyme responsible for making it. So, chronically stressed individuals have measurably lower nitric oxide activity. Their vessels stay constricted as a result. Second, it promotes sodium retention in the kidneys. Elevated cortisol signals the same hormonal pathway that aldosterone uses to tell your kidneys, hold on to sodium, hold on to water. More sodium retained means more fluid volume. More fluid volume means higher pressure. Third, and this one surprises most people, it accelerates arterial stiffening by promoting inflammatory markers that degrade the elastic fibers in your vessel walls. Chronic stress makes your arteries physically older faster. Now, here's the thing about older adults specifically. The kind of stress that drives this isn't always dramatic. It's often quiet. It's the chronic worry of a long illness, the loneliness of living alone, the unresolved grief after a loss, the low-level daily anxiety of managing multiple health conditions. These experiences, real, legitimate, often dismissed, are having measurable effects on the cellular biology of your cardiovascular system. And here's the important message. This isn't hopeless. There are specific evidence-based interventions for this mechanism that go far beyond just relax. I'll walk you through them in the protocol. If this part made something click for you, take a second to like the video and share it with someone who's dealing with stress and blood pressure, because this is one of the most overlooked pieces of the puzzle. And stay with me. In the next section, I'm going to show you exactly how to start reversing this step by step. All right, now let's get to the part you've been waiting for. I want to be very clear before I begin. This protocol is not a replacement for your medication. If your doctor has prescribed you blood pressure medication, keep taking it while you implement these steps. What this protocol does is work on the structural, cellular, and metabolic causes of hypertension, the things your medication is not designed to fix. Over time, as your body responds, work with your physician to reassess whether medication doses can be reduced. Never adjust medication on your own. With that said, let's build your plan. Step 1. Protect and restore your endothelial lining. The goal here is to stop the 3 destroyers, blood sugar spikes, chronic inflammation, and oxidative stress, and start providing the building blocks your endothelium needs to heal. For blood sugar control, you don't need to follow a strict diet. You need one practical rule: pay attention to what happens after you eat. The research on post-meal blood sugar spikes and endothelial damage is compelling. Avoid high glycemic foods, white bread, white rice, sugary drinks, pastries, sweetened cereals, particularly in the evening. Replace with fiber-rich, whole foods that slow glucose absorption. Legumes, non-starchy vegetables, berries, and moderate amounts of whole grains are your allies here. One practical tool: a short 10-minute walk after your largest meal. Multiple studies have demonstrated that even brief post-meal walking blunts blood sugar spikes by 20 to 30%. It's not about burning calories. It's about using your muscles as a glucose sink before that sugar has a chance to damage your vascular lining. For inflammation reduction, increase omega-3 fatty acids through fatty fish 2 to 3 times per week. Salmon, sardines, mackerel. These directly reduce the inflammatory cytokines that damage the endothelial surface layer. Extra virgin olive oil as your primary cooking fat. Dark leafy greens daily, not just for magnesium, but for their potent anti-inflammatory polyphenols, for oxidative stress. Colorful vegetables and fruits are not optional at your age. They are medicine. Berries, especially blueberries, contain anthocyanins that have been shown in multiple trials to improve endothelial function markers. Aim for a cup daily. Dark chocolate, minimum 70% cacao, contains flavonols that genuinely measurably boost nitric oxide. A small square daily is not an indulgence. It's a prescription. Step 2. Restore your magnesium levels. This step is straightforward, but requires you to be specific about form. The most bioavailable and gut-friendly forms of magnesium for cardiovascular health are magnesium glycinate and magnesium malate. Avoid magnesium oxide. It's cheap, common, and poorly absorbed. Target dose for most adults: 300 to 400 milligrams of elemental magnesium daily. Split the dose. Take half in the morning, half before bed. The bedtime dose has the added benefit of supporting sleep quality, which itself reduces cortisol and blood pressure. One caution: if you have any kidney disease, talk to your doctor before supplementing magnesium. Your kidneys regulate magnesium excretion, and impaired kidneys may not handle supplementation safely. Also, look at your current medication list. If you're on a diuretic or a proton pump inhibitor, discuss with your physician whether regular magnesium monitoring makes sense for you, because depletion may be ongoing and supplementation may need to be maintained long-term. Step 3. Rebuild your nitric oxide system. Two practical interventions here that work independently but beautifully together. First, dietary nitrates. Your body makes nitric oxide partly from dietary nitrates converted through a pathway in your saliva and gut. The richest source: beets, specifically beet juice or concentrated beetroot powder. Research has shown that 200 to 300 milliliters of beet juice daily reduces systolic blood pressure by an average of 4 to 10 points. That's not a trivial number. That's in the range of what some medications achieve. Other high nitrate foods: arugula, spinach, celery, and pomegranate juice. These aren't trendy superfoods. They're biological precursors to a molecule your arteries desperately need. Second, nasal breathing and humming. This sounds almost too simple to be real, but your nasal passages are a factory for nitric oxide production. Research has shown that breathing through your nose generates significantly higher blood nitric oxide levels than mouth breathing. Even more surprisingly, humming, yes, actual humming, creates vibrations in the nasal cavity that amplify nitric oxide production by up to 6 times compared to quiet breathing. A practical daily habit: 5 minutes of slow, nasal-only breathing in the morning with gentle humming on the exhale. This is one of the most accessible vascular health interventions available to anyone at any fitness level at any age. If you're still here with me and finding this helpful, take a moment to type 3 in the comments. It lets me know you're watching and getting value from this. Step 4. Address the stress vessel mechanism directly. This step is about the chronic stress pathway, and it requires a real intervention, not just a suggestion to reduce stress. Intervention 1. Structured slow breathing protocol. Research from multiple controlled trials has established that slow-paced breathing, specifically 6 breaths per minute, or about 5 seconds in and 5 seconds out, activates the parasympathetic nervous system, lowers cortisol, and produces measurable reductions in blood pressure during and after practice. The protocol: 10 minutes daily, ideally at the same time each day. Breathe in slowly through your nose for a count of 5. Hold for 1 count. Breathe out slowly through your nose for a count of 5. That's one breath cycle. Repeat. After 8 weeks of daily practice, published clinical data shows average reductions of 6 to 8 points, systolic, modest, but real and cumulative with the other steps. Intervention 2. Progressive muscle relaxation before bed. Chronic nighttime cortisol is a major driver of morning hypertension, that well-known spike in blood pressure that occurs in the first hours after waking. A simple routine of tensing and releasing major muscle groups for 15 minutes before sleep has been shown to reduce nighttime cortisol levels and blunt that morning spike. Start at your feet. Tense the muscles tightly for 5 seconds. Release fully. Work upward through your calves, thighs, abdomen, chest, hands, arms, shoulders, and face. The complete sequence takes about 12 to 15 minutes and is one of the most underutilized tools in cardiovascular medicine. Intervention 3. Social connection as vascular medicine. This isn't soft advice. A landmark analysis in the journal Hypertension found that socially isolated older adults had significantly higher blood pressure and faster arterial stiffening than those with regular, meaningful social contact. Loneliness chronically elevates inflammatory markers and cortisol, both of which, as we discussed, directly damage the vascular system. If isolation is part of your life, make one structured social commitment per week a medical priority, not optional. Medical. Let me bring this full circle with a simple truth. High blood pressure in most older adults is not a mystery. It is not simply genetic fate, and it is not a life sentence written in your DNA. It is the accumulated result of 3 specific mechanisms: endothelial surface damage from blood sugar and inflammation, magnesium depletion silently constricting your arteries, and chronic stress, keeping your vessels in a permanently activated state. Standard care gives you a medication that manages the pressure reading on your monitor. And thank goodness for that, because uncontrolled blood pressure causes strokes, heart attacks, and kidney failure. And medication is an important bridge, but a bridge is not a destination. The destination is a repaired endothelium, minimally replete, relaxed arterial muscle cells, a nitric oxide system that works, a nervous system that knows how to return to calm. That's the work. And it is work you can begin this week. If you made it to the end of this video, I want you to do one thing right now. Before you close this tab, before you move on, pick one step, just one, the one that resonated most with you today. If you're eating a lot of processed carbohydrates and sugary foods, start with step 1, the post-meal walk and the dietary changes. If you're on a diuretic or a PPI and you've never had your magnesium checked, call your doctor this week and ask. That's step 2. If you're not getting enough vegetables and you've heard yourself breathing through your mouth while you sleep, step 3 is yours. And if you know honestly that stress and isolation are part of your daily life, step 4 might be the most important thing you can start today. You do not have to overhaul your entire life overnight, but you do have to start somewhere. And now you have the why, which is the most important thing a doctor can ever give you. The information in this video is for educational purposes only and is not a substitute for medical advice. Please consult your healthcare provider before making any changes. Individual results may vary. If this video added something to your understanding of your own health, hit subscribe, because every week I come back here to give you exactly this: the real biology, the real mechanisms, and the real strategies, not to scare you, to arm you. Take care of yourself. Share this with someone you love who's managing blood pressure, and I'll see you in the next